In the House is the new state health officer of the Mississippi State Department of Health, the one and the only Dr. Dan Edney. Last time he was here, he was a deputy, but I think that has been changed now. Good morning, Doc. How are you, sir?
Good morning, Paul. Good morning, Perez, sir. Good to see y'all.
It's good to have you in the big chair there.
It will be official August 1st.
Oh, so it's not official till August the 1st.
That's correct.
I got you. Well, all practical purposes, we know where that is now, though. Where in the world do we start here? I wanted to mention this one, and I was talking to Chris Howard about this. Where do we stand with COVID now? What variety is this? What's the very latest from the health department?
Well, COVID is still very active. We are still dealing with Omicron with its different variants. Now we see what's called the BA.5 variant that's steadily gaining in the state and nationwide. And what that means for us is this variant not only is highly contagious, but it is better at evading natural and vaccinated immunity. We are still seeing great benefit, especially from being up to date with your boosters and preventing hospitalization and death. But, if you're paying attention, just so many people are getting COVID now. Thankfully, the cases tend to be mild, but not all of them. Our hospitalization rate is going up. Thankfully, the death rate is staying low, but it's not zero.
BA.5 is the fifth variety of this? Is that what that means? Or?
That's just the genetic profile of the Omicron variant we're dealing with.
When you say that it's more resistant, does that mean it's resistant to medication or when?
No, sir. It's just better at evading the antibodies produced by natural infection or by vaccination. So it's able to get in and infect us more easily than the other variants. But the vaccinations and natural immunity do help keep us, from getting seriously ill and dying from it. So it's so important for everybody to be up to date with their vaccine.
When we had, most of us in this audience, had that first round of the two shots and the booster, is that what you're talking about as far as providing some immunity, or is that immunity far gone now? No,
we're still dealing with the same vaccine thus far that we have since they first came out. We do expect an updated vaccine later this fall, but we're, even with the current vaccine that we've been using, if you're up to date, which if you're 50 or older means that you need a second booster, so that's 4 shots. So, those of us in the studio need 2 boosters. And especially if you're immunocompromised, if your physician thinks that you very well have not been able to mount a good immune response based on illness, chemotherapy, different medications that suppress the immune system, then you definitely need to have your second booster. But also you need to talk to your physician about EvuShield, which is the monoclonal antibody that helps prevent COVID for those who are immunocompromised, and it lasts for 3 months. So it'll give an immunocompromised patient 3 months protection.
Are we more like, in other words, is the fall of the year going to be one of those things where we're back to all wearing masks and maybe some limitations out there as far as travel and things?
Well, unfortunately, we're already back to high transmission levels. Warren County, my home county, and Hinds County here is already back up to being in the red zone, being high transmission levels, which means we definitely recommend that anyone at higher risk wear a mask as much as they can, certainly indoors. We advise everybody to wear a mask as much as they will, especially when they're around others who may be at risk for getting ill. But, we're reaching a stage where it's endemic. It's not going anywhere, at least no time soon. We're trying to learn how to live and work in this environment and try to develop some equilibrium with this bug and try to have life as normal as we can, but still try to be safe.
From the data that you have at the health department, where does flu figure in this time of the year?
We're actually, it's unusual, but we are still having flu reports coming in from the clinic. So we're seeing both COVID and flu being reported in. So it really, and that is worrisome for what the fall will look like.
And when you get old and you have to bring it in for an overhaul as far as the body's concerned, we are due a lot of different shots. I mean, the shingles, you got to have your pneumonia shot.
That's
you got to
right.
have your shingles shot. The shingles part of that scared the hell out of me when I first saw it, and I made sure the next day I got the shingle shot. But shingles, pneumonia, and I'm not sure on that one 1 or 2 different shots, but I've had one. And then your flu shot, and of course your booster shot. So it's in one hand, we ought to be thankful that those things are available to us.
Absolutely, I'm very thankful that we have the COVID vaccine. I'm thankful as a physician, certainly thankful as a public health physician, but I'm very thankful as an individual, husband, father, grandfather for these vaccines.
Absolutely,
they definitely are saving lives.
I want to talk about the health department across the many counties. But first of all, the other thing I want to touch base, because we don't think about this, but we're already on the 19th of July. We'll be back to school pretty soon for our public schools and private schools in the state. Give me an update on, and people need to know this, but you have to do this ahead of time, as far as the shots and the vaccines that are required.
Yeah, we still have the same mandated BA.5 vaccines that that we give every day at the 82 various county health departments. We're a major provider of back-to-school shots for the state. We oversee the Vaccine for Children's program, which provides those vaccines to the children of Mississippi. We not only administer them ourselves in the county health departments, but we partner with pediatricians and family medicine docs across the state so they can give them in their offices.
But if the kids go to school for the first time, they're going to have those shots.
They do. It's state law that for the mandated vaccines, they have to attend public school, that they have to be fully vaccinated.
I got you. Not private, but public schools, of course.
Well, the private schools follow suit.
And, do they?
So
in parochial schools too?
Yes. So pretty much in Mississippi, if you're if you're not going to have your child vaccinated, then as of now, it means homeschooling.
Let's talk about that, because we had Representative Becky Curry on. We were talking about the health departments, I think last week, and so I went to the website and I started taking a look at them, and your health departments the pictures are there, and I don't know. I got the overview in my mind after we got through with that interview that many of them were shut down and they were not funded at all, but it seems that they're pretty active and are being well used in most counties out there.
Yes, sir. Like I said, 82 of them across the state, and
even the Essequibo County.
Absolutely, and and I'm from Warren County. Grew up in Washington County, so I know all those counties. But the county health departments I can understand the representative, not being as up to date of what we're doing now, because we're pretty low profile. People who need us know us. They know where we are. They know what we do. People who don't need us may well not even know where their county health department is, and that's okay. We are there to provide basic services for those who have difficulty with access to care otherwise. In terms of clinical services, which I think y'all were talking about last week, we are only the provider of last resort. So we're not competing with anybody in private medicine, which is why a lot of the services y'all were talking about we no longer provide. They're provided by private clinicians.
I got you. We'll talk more about that and a couple of other things when we come back with Dr. Dan Edney, the new state health officer as of August. Right after. We'll be back live with Dr. Dan Edney in one more segment here, but I do want to ask you, there's so many other things. Is there anything particularly that you want to mention here? Because so many other things are going on at the health department that's at the top of your list.
Well, we do so much at the Mississippi State Department of Health. We're probably one of the few state agencies that actually touches the lives of every Mississippian every day. So if you've had a drink of water this morning, you can thank the hard workers at the health department that it's clean and didn't make you sick when you brushed your teeth. We regulate restaurants for food safety. We And our clinical services are limited, but they're directed for specific purposes. But, we still provide family planning in the county health departments. We still do HIV, STD screening, treatment, and prevention. We provide breast and cervical cancer screening for women aged 50 to 65 without insurance. We oversee the WIC program for nutritional supplementation for women, infant, and children. It just goes on and on and on what we do. But remember, we're about population health. We are here for the public health rather than just the individual. We're looking at the health of the entire state. So our programs are directed with that viewpoint.
Which always amazed me, and we sometimes have to be the bearer of bad news, because when we get these wallet hub things out and all of these surveys, we are the poorest, we're the unhealthiest. We don't do this, we don't do that as far as infant health, et cetera. And then I started looking at all the services we have in the state. Goodness knows the two probably busiest in the state are the two that we had on this morning. The Department of Rehab with so many different services, and you guys. You look and see all of those services are available. And then are we gaining ground on this, though? I mean, because is it a situation where we have a lot of people, a significant amount of the population, that are not taking advantage of it?
Well, unfortunately, when you look at the health of our state, we are still impacted significantly by health disparities. We received our health disparities report card just about 2 months ago. Mm-hmm. And, Paul, we're not only 50th. When you get down, let's see, West Virginia is 48, Oklahoma's 49. You get to Mississippi 50th, and we're not only 50th, we fall off the cliff to 50th. Every demographic in Mississippi is below the national median in terms of health outcomes. So, every group, white, black, Hispanics, Native American, all of us are below the median, which means the average Mississippian is less healthy than the average person from Connecticut. So we have to look at all the things that, we have been fighting these issues for a long time. As you say, we don't have enough resources to deploy, but we're trying to deploy what we have efficiently and effectively. But, Paul, you got to, I've been in private practice for 31 years before coming to the health department. You can imagine it took a lot for me to make that decision to make this change and accept this job. And the reason I did it is, as a physician, I am embarrassed and ashamed at those health disparity reports. We just cannot accept the fact that black women in this state die during pregnancy at a rate of 3 times the national average, twice the number as white Mississippians. So white Mississippi women are dying in pregnancy higher than the national rate as well. Our babies are dying at higher than the national rate. And I just refuse to accept the premise that it's just our fate to be unhealthy. Mm-hmm. It's our fate for our mothers and our children to die at a higher rate than every other state. I just refuse to accept that as a physician and as a Mississippian, and certainly as a state health officer. I know we can do better, but it's going to mean looking at everything differently and trying new approaches that we've never tried, like the Healthy Moms, Healthy Babies program that we're rolling out this month, which is a home visitation program to try to help these mothers while they're pregnant and help their babies in their first year of life, to intervene to keep them not only healthy but keep them alive.
And as you said, as you take over next month as the state health officer, it's going to coincide with the ending of Roe versus Wade. So how's that going to play into it?
Well, I think it's incumbent upon us as Mississippians to invest in pregnant moms and their children and their families. I think it's, we have got to look at moving postpartum care back out to a year again. 2 months is not enough. We have women who are dying in months 3, 4, and 5 from complications of pregnancy.
I never understood why we didn't at least go to the 6 month. It just didn't make sense.
And it's budget neutral, so it doesn't cost the state anything. It has to be budget neutral. But it's important that we invest in our pregnant moms and their infants. And this is like the easiest thing to do.
Because falling off that cliff, as far as the numbers are concerned, and understanding that we have agencies out there, inclusive of you guys, with prenatal and postnatal care, again, I go back to the question, is it just not being used, or what we have is inefficient?
Well, there's, when you look at health disparities, we look at equality issues, which means do everybody have the same resources, and then equity issues, which means do they not only have the same resources but the ability to use those resources. And I would say, as you and I being Delta guys, we know that it's harder for a pregnant mom to get high-level, high-risk pregnancy care at the Mississippi Delta than it is in Jackson. So we have to look at the data. We have to be data-driven, and we have to look at the highest impact areas, and we need to go into the communities like we did with COVID and listen. Listen to the communities that are being impacted of what's going on, what trouble are you having, what barriers are you up against, and what solutions do you see, and how can we help you with these solutions for this? Because, Paul, when we change these numbers even a little bit, people live. We have people who are alive who otherwise would be dead.
Certainly as far as senior citizens, too. Well, it's just seniors. When you get over 50 years old, many people just have never had a colonoscopy, which is something that, if you have it on a regular basis, then that could save your life.
Absolutely.
And I would imagine there are a lot of people in that age group, also in that income group, that have never had, 70, 80 years old and never had one.
That's right. And, colon cancer is a preventable illness, virtually totally. Meaning that if you start your screening at the recommended time, at least no later than age 50, and younger if you're higher risk like I am, we identify polyps, remove them, and cancer never develops. And so,
let me ask you this: is there a program for yearly physicals from the county health departments or something of that sort?
Yeah, we do that through our family planning programs. The women get an annual medical exam, and we do it through our BCCP program, which is breast and cervical cancer prevention program for women without insurance age 50 to 65. But someone without insurance can't just walk in and get a physical at the health department. We're not capable of doing that. I
got you. One of the things that I've always said, and it seems to be a good idea, must not be, and I must be thinking at an elementary level, but health savings accounts, I've always thought was something that would inspire people to be a little bit more proactive as far as their health is concerned, but it never gains any ground. Well, anything else before we let you go and run out of time here?
Well, I think to tackle these problems, and if you come visit me at my office, and I invite you to do so, you will have to walk past what I'm calling the graph, and it is the graph of where we are with health disparities and our health outcomes in the nation, and it's a reminder to all of us at the health department what we're doing and what we're trying to achieve, and I'm bound and determined that we will not be 50th forever. That by the end of my administration, that we will be better than we are today. We're better in education. We've done it in education. We can do it in healthcare as well. It means giving access to the care for everybody.
Number one on the agenda for the 2023 legislative session in your mind is what?
From the health department is to get the funding we need to keep doing these services that are desperate for Mississippians to have. I promise you that.
Always a good and informative visit. Don't be a stranger, sir. Anytime you need us, give us a call.